Hello everyone and welcome to this webinar from econSystems on the challenges of depth of field in macro imaging. I am Bharat, Market Manager for Medical Cameras at econSystems, and I'm joined today by Vignesh, our Senior Camera Expert. Over the next 30 minutes, we'll see how limited depth of field impacts medical applications. Second, the key design factors that influence depth of field. And finally, we will walk you through a case study of a camera designed for macro imaging. Please feel free to post your questions in the chat as we go. We will address them during the Q&A at the end. Before we get into the details, a quick word on who we are. econSystems is a global embedded vision solutions provider with over 20 years of experience in designing, developing, and manufacturing OEM cameras and vision platforms. Since 2003, we have delivered end-to-end vision solutions from camera modules and vision boxes to ISP tuning, software, and system-level integration. We offer a broad portfolio of vision technologies, including MIPI, USB, GMSL, GIGI, stereo, and AI-ready cameras designed for seamless integration with leading processors like NVIDIA, Qualcomm, Umbrella, NXP, TI, and others. With millions of cameras shipped and 350 plus customer products deployed globally, econSystems enables faster time to market and long-term product success. When it comes to medical applications, imaging is not just about performance. It also requires regulatory compliance, high reliability, and tightly controlled manufacturing processes. For regulatory compliance, we support certifications such as CE and IEC 60601 with design controls, documentation, and traceability built into the development process from the outset. On the manufacturing side, we deliver medical grade vision solutions from ISO 13485 compliant facilities. Our facilities include clean rooms, precision process like active alignment and IP67 validation, and inline image quality testing such as MTF and color accuracy checks. This result is consistent quality, extremely low field failure rates, and 3-year warranty with products shipped to over 90 countries worldwide. We support customers through a structured product lifecycle management approach, including early design collaboration, proactive change, and obsolescence management, support external product lifetime, and well-planned end-of-life transition. This is how econSystems is specially structured to medical device development. In summary, econSystems is a proven long-term imaging partner. With that overview, let's get into today's topic, depth of field challenges in macro imaging. Before we dive in, let's align what macro imaging really means. Macro imaging captures objects at very close working distances so that the small structures appear significantly large on the sensor. We are talking about high magnification ratios, often 1:1 or greater, where the object size of the sensor closely matches its real-world size. In normal imaging or wide field imaging, the camera is captured to broader scene. The subject occupies a smaller portion of the sensor, providing a large field of view and greater scene context. This approach is well suited for imaging larger anatomical areas, general inspections, or situational awareness where depth variation is relatively small compared to the working distance. But in contrast, macro imaging fundamentally changes the optical setup. The camera is brought much closer to the subject, and the system is optimized so that the region of interest fills most of the sensor. This maximizes spatial resolution on small features. Higher magnification brings more details but less focus. That limitation is depth of field. Depth of field is a range of distance along the optical axis where objects appear acceptably sharp. In simple terms, Depth of field answers one question: how much of your subject front to back stays in focus at the same time? On this image on the left, you see only the focal plane is sharp. Object slightly forward or behind is blurred. But on the right, a wider range of distance stays sharp. More of the scene near and far and from the focal plane appears sharp at the same time. Now, let's look at how this plays out in real world applications. A common macro imaging application is dental intraoral imaging. And intraoral imaging, the camera is used very close to teeth. A dentist is not just looking at one teeth, they also need to see adjacent teeth, interproximal areas, and gingival margins in the same view. When the depth of field is shallow, only part of image is sharp and the rest becomes blurred. This leads to retakes, longer chair time, and in some cases, important clinical details can be missed. Poor image quality or shallow depth of field can affect AI-based diagnosis as well. AI algorithms rely on clear and consistent focused images, and blurred regions can result in missed findings or incorrect classifications. On top of that, partially focused images weakens clinical documentation and can even lead to insurance claim rejections. So, poor depth of field can impact diagnostics accuracy and clinical efficiency. Now let's look at ENT applications, particularly otoscope imaging. The ear canal is narrow, a three-dimensional structure, and clinicians need to visualize multiple depths: the canal walls, cerumen, and tympanic membrane at the same time. With shallow depth of field, only a small region stays in focus. Clinicians are forced to constantly reposition the device to bring different structures into focus. This increases examination time and becomes especially challenged with pediatric or uncooperative patients. In this case, depth of field directly affects procedural efficiency, patient comfort, and exam reliability. In dermoscope, the depth of field challenges shows up in more subtle but critical way. Dermatologists rely heavily on lesion boundaries, texture transitions, and color patterns to access malignancy risk. These features often exist at slightly different depths across the lesion. When depth of field is shallow, part of the lesion, especially edges or subsurface patterns, fall out of focus. This can alter how lesion borders are perceived and reduced confidence in visual assessment, particularly in borderline or early stage cases. So in dermoscopy, depth of field directly impacts boundary interpretations and clinic confidence, even before any downstream analysis is considered. So as we see in every applications, clinicians are forced to trade details for coverage, and that trade-off directly influence patient outcomes. So the real question becomes, how do camera designers work with these constraints? Vignesh, over to you. Walk us through the design strategies and trade-offs involved in camera development.
Thank you, Bharat. Good morning, everyone. Let us see how depth of field becomes limited in macro imaging. The simple reason is that in macro imaging, the camera is placed very close to the subject. As the camera moves closer, magnification increases, and as magnification increases, the depth of field reduces very quickly. Unlike normal imaging, where the subject is far away and most of the scene naturally stays in focus, macro imaging pushes the optical system into a regime where only a very thin region remains sharp. Even small change in the distance can cause part of the image to go out of focus. In macro imaging, depth of field is not controlled by a single parameter. It is combined effect of magnification, sensor characteristics, working distance, and aperture